Chief Executive Officer of the European Social Network, and it is a pleasure to welcome you all to this webinar today, which is organized with our partner EY. I know that we've got a large number of colleagues joining us, which is excellent. There are more than 100, so we are slowly going to start this webinar while colleagues keep on joining us. I would like to remind you a couple of things. This webinar will last for approximately 1.5 hours. And during this time, we're going to run through a number of presentations, but also you will have the opportunity to participate in the conversation. For this, you've got the Q&A section, so you can use it to send us questions as you listen to our speakers this afternoon. I also would like to remind you that if you want to follow the conversation as well, you can also look at the captions. So we've got subtitles. So if you want to, you can also follow it that way. Now, I would like to tell you a little bit about this webinar this afternoon and the agenda, and introducing you briefly to the speakers who are with us today. We've got with us Jessica Chamba. Jessica is the global social services leader for EY. We've been working with EY for a number of years through our partnership, particularly in relation to the European Social Services Conference, which this coming year will be in its 33rd edition, and the European Social Services Awards, as well as a series of webinars like the one we are organizing here today. And we've got with us Teresa Leonard, who is the Deputy Secretary of the Department of Social Protection in Ireland, and she's going to take us through the centralized register with automatic welfare supplements. And our third speaker is Erja Ailio. She's a Chief Specialist at the Institute for Health and Welfare in Finland, and she's going to take us through case studies in relation to data collection in 300 Finnish communities. After that, you will have the opportunity to participate in the conversation as well, as I said, through the Q&A section. So I would like to do a very brief introduction to the topic that we are going to be addressing here today in relation to data. If we can move on to the next slide. Just a couple of milestones in relation to the work that we do within the European Social Network. Just before and during the pandemic, actually, we ran a working group on social services digitalization. And in this working group, we've noticed this before, but certainly in this working group, we realized the key importance of data and how powerful data can be, but also how limited you might be in relation to not having the right type of data. Not only what type of data you collect, how it is being collected, and most importantly, what are you using this data for? And in the framework of our working group on transformation and resilience of social services, this year we focused on the digital strands of things. And in particular, we looked at case management and the use of AI for predictions. And there we realized how having a set of data which you can use in order to develop algorithms that then can help to, let's say, prompt you as a case worker or a case manager or social worker into what type of decisions you can make is particularly important. But of course, data is really interesting because data is as good as the individuals who manage that data. One of the key things that we've realized, I remember back in the year 2023, at the European Social Services Conference, where we specifically focused on the topic of digitalization and technology, is that the use of data can certainly be very biased. We've seen this, for instance, with artificial intelligence. If you don't have appropriate safeguards in relation to what type of data, or how is the data being collected, and also in your own services, then you can actually reproduce stereotypes or certain social situations which can then reproduce in the data and obviously in the way you're using that data. This is something that I would be particularly interested in hearing either in the presentations or when we have the conversation later on. So let's move on to a couple of challenges in relation to data. We have a working group called the Social Services Index. This is something that we launched in the year 2023. In order to support the European Commission and the work that they do in relation to economic and social policies in the framework of the European semester. And one of the things that we try to do is to change the way we are contributing to this work, to understand better what's the situation in relation to social services across different European countries. And we do this by collecting data in relation to legislation and policy, expenditure, and coverage of social services. One of the issues we've realized there is the challenges that we have to collect proper data. For instance, expenditure. How can we actually understand what is being invested in social services? Well, the truth is that we can't. We can't because actually, when we look at how countries are collecting data, there is lack of coordination in relation to the data that is being collected and what type of data is. For instance, we cannot isolate social services in kind because most of the data that is being collected is in relation to financial benefits. So another issue we've got is whether the type of data that is being collected is the right one in relation to the services that then we need to develop. And this is particularly important because services should be developed based on the data which then responds to the assessment of needs, both at an individual level, but also at a social and a community level. Another issue in relation to data is that people, and this is an issue with systems, people are supported by services which are at different government levels. So what you've got there is that different government levels are collecting data in a different way. But of course, we are referring to the same person. So this is a serious issue as well. And this is very much related to the lack of interoperability between governments and public administrations. This morning, I had a meeting with colleagues in the European Commission, and we were talking about data in relation to social security, for instance, which actually is very much relevant to social protection as well. But the truth is that there is a lack of communication between both sectors or both areas of the same social policies. And in terms of if we move on to the next slide, in terms of the reason as to why this matters, it does matter because, of course, data evidence is key to develop programs which are more person-centered. The data is key to be able to detect issues which might be emerging so that they can be addressed before they become more serious. This is a key aspect of the use of different sets of data with the help of artificial intelligence. Is key to be able to identify best those who are in need, particularly in situations in which we know that resources are limited, but also needs are expanding, particularly in the context of demographic aging. And also understand what the needs are so that we can put in place better service provision, which is quite difficult if we are not able to capture the situation in the right way. So these are some of the key things and the key concerns for us. And indeed, this webinar is taking place at a timely moment. We are now preparing for the 33rd edition of the European Social Services Conference, which will be taking place next year at the end of June in Denmark. And we are going to be talking about relational welfare and welfare technology and how those two concepts are two sides of the same coin, how they need to come together to support the transformation of social services. So we are looking for proposals. So we hope that you would be interested in applying. And certainly this webinar comes at a time of preparation for the conference, which is very timely, as I just said. Now I'd like to give the floor to Jessica to introduce us to the topic and to tell us some of the key work that they've been doing in EY in relation to the power of data.
Thank you very much, Alfonso, and thank you to the whole team of the European Social Network for giving us the possibility to tackle this very interesting subject with you and with our guest speakers this afternoon. So I'm Jessica Chamba. I'm Global Human and Social Services Leader at EY, and I'm based in France. So I will give you a bit of a perspective, but actually Alfonso has started tackling the subject already. I think we all agree on the fact that technology has the potential to concretely transform the way social services are delivered. And the main challenge is, how do we implement it? Where do we focus first? What are the hurdles we need to overcome in terms of data integrity, system integration, siloed working practices, which is a true difficulty, and many other issues I think we will be tackling this afternoon to see how concretely we can try to overcome them. Many of these central issues or hurdles to overcome are quite familiar to you, I suppose, but I just wanted to give a short snapshot of what we have seen. One of the key thing is that data is sitting in siloed departments, and Alfonso has already mentioned that. You have the question of the different levels of government, but you have also the question of inside one same level of government, you will have the housing department, the child protection department, the social services, etc. And so this question of who has the mandate to give this one view of one person is a challenge. And also the lack of these systems interoperability to connect the dots between the systems is key. There is also this question of how data is used as a byproduct of a program and not as a driver. So very often we see data still just as counting how many people are getting that grant or getting that support. But actually the idea to use the data to identify better what are the needs of the people, what are the different services they are addressing to, and how do we measure effect and impact of our programs is a deep change for most of our systems. We also have this question of how do we manage the fact that we have fewer workforce and fewer caseworkers. Workforce, our social services people are often not equipped with the technical proficiency to use this technology efficiently, or they don't even see the interest in doing that because this does not help them in their daily tasks. And this is where technology has and should bring concrete added value, of course, for the people in the end, but also for the people working in social services at first. And then at the end, also the fact that the system are predominantly set up to react to individual situation rather than taking early intervention as a prevention approach. And this is really something in which we believe that we should invest a lot, and that taking a more data-centric approach that would provide frontline workers with more relevant and more timely information will allow social workers actually to identify potential issues earlier and put measures in place to concretely support individuals ahead of a crisis situation and create a more positive outcome for the whole system. This is also interesting for the governments and for the social protection system, as it might be cheaper for them to administer if we have a complete vision. I have a second slide, but I'm going to go through this one very fast because this is more about what are the key points on which we think that we should develop a smart safety net approach. Here the question is, if we take a system-wide approach, we can address the needs of individuals and families by joining up the data points across departments to create this single view of a vulnerable person. And therefore, by focusing on a human-centered design that brings together all of these aspects and services, we can create this more holistic view for the people to help them struggle throughout their lifetime. Also, by establishing data-driven policies, services, or workflows, and using automation, which is something that can concretely provide fast service for our caseworkers, this will enable them to put early interventions in place and to be more efficient in their way of working. Also, by using analytical tools, we can reduce the administrative burden on caseworkers and draw far more insights that improve the decision-making process. And this will allow caseworkers to build stronger relationships with their individuals in their care. And in the end, we also suggest to adopt outcome-based commissioning of services that are measured and that are that we can evaluate. And this is also a big step forward in which data can help. So In the end, of course, each country and each social services department has their own unique challenges, but many of them are common to everyone or to many social services we can analyze in the world. And as some organizations are moving ahead on some topics, we thought that it would be nice to have this opportunity to learn from these leaders to understand how they have looked at their own issues, how they have found solutions, and how they are concretely providing services to understand how providing services to vulnerable citizens in a more efficient and more effective way. And so, Christina, you can show the next slide. Maybe I'm so pleased that we have two guest speakers today. So Alfonso already introduced them. I will just say a few more words. We will hear first from Erja Ailo. Erja is a team leader at the Finnish Institute for Health and Welfare. And she has overseen the development of a client data model for social welfare. And she will speak to us about how this work that has been done in Finland can connect together data coming from different systems and from different levels of authorities. And then we will hear from Teresa Leonard, who is the Deputy Secretary for the Department of Social Protection in Ireland. Teresa has held many roles in this department, but also working on child and disability issues. So Teresa will speak to us about one concrete example of service modernization regarding service offering for families and newborn children, and how this has helped the Department of Social Protection provide a more complete and holistic view of the person and their needs. Erja, if you are ready, I would like to give the floor to you first. The work you're doing in Finland is very interesting, I think, regarding how to work concretely on this interoperability of data and interconnection in the system. And so please let us know what you have done and how it is working at the moment.
Thank you, Jessica, and thank you, ESN, for inviting me. It's really nice to be here today because we have such an important topic today. Now I start sharing my presentation. Is it working now? Is it?
Yes, perfect.
Okay, you can see it. Great. Okay, my name is Erja Ailo, and as mentioned, I'm currently working as a chief specialist in Finnish Institute for Health and Welfare. Today, I'm going to tell you some key points of the development of social welfare information management in Finland. The starting point was that social welfare client data was inconsistent and it was available only in local organizations. And it's good for you to know also that Finnish social welfare and its information management is based on numerous laws. So what are the goals and benefits which we pursue? We want client data to be easily accessible, not only for the professionals, but also for the clients. Then also the documents are clients' own documents and not only the professionals' notes. In secondary use, we pursue knowledge management, comparability, statistic, and effectiveness assessments, both regionally and nationally. And here's how Finland has solved the issue of data availability, consistency, and documentation. This picture has been with us for a long time. It illustrates the challenges we faced and the improvements we made. I will present the two key dimensions of client data usability. data consistency, and data availability. At the starting point at the low left corner, client documents are lacked consistency in both content and structure, and they were only accessible within the organization that created them. Our goal was to create harmonized data model for client documents in social welfare, and the documents were to be available 24/7 for different purposes. After an extensive collaboration, we developed SOSMETA. SOSMETA is a web service that standardizes the client information structures and contents. Furthermore, we adopted the approach also used in healthcare information management, storing all client data in a national repository called Kanta. These ensure that professionals can access the data whenever and wherever they need it. One of the key foundations in the development is the Client Data Act we have. In the next few years, all Finnish social welfare providers will start using the Kanta according to the Client Data Act. This will mean that social welfare professionals will all use standardized systems to record client data. As information management is being harmonized, the daily working methods are also in change. The development is carried out in close operation with various stakeholders, and it emphasizes not only the needs of social welfare professionals, but also the needs of clients. It's quite important that different stakeholders are motivated by the same vision and goal of knowledge-based social welfare. THL's role is to provide steering and support to social service providers, information system manufacturers, and system suppliers. We give guidance and training in structured documentation for the welfare professionals. Other important role is that we provide document structures and classification. THL is also one of Finland's statistical authorities. Before we can expect reliable client information, we need to do some specifications. We need shared terms and vocabulary so that not only the humans but also the information systems have a common language. To get structured data, we need shared classifications and code system. We also need document specification, for example, document names and content. To make sure the information systems work properly, we also need some technical requirements and integrations. And after these steps, we can start producing more reliable client data. THL's national guidelines are all published in handbooks and included also in the client document structures. Development of the social welfare client data repository, part of Kanta services, has been done in stages. In 2018, the data repository was opened for voluntary deployment. MyKanta, which is the client's interface, was opened in 2023. All social service providers must start using Kanta services with a client information system by September 2026. So we are not there yet, but there is a lot of progress going on. A major change for social welfare professionals will be structured documentation. That's why for over 10 years, THL has been proactive in improving documentation skills. there has been several regional and national projects. Thousands of documentation specialists have been trained, and now every region has their own documentation coordinator. Oh,
yeah.
There was something going wrong. Can you hear me now?
Yes, we hear you again. We lost your presentation. But
okay, should I start sharing again?
You can.
I'm sorry about the technical issues. Just a minute.
Yes, we see back on the first slide. But we were almost getting. Thank you. Yeah.
Yeah, now it's the right slide.
Exactly.
Okay. I was telling you about the new national data register.
Absolutely.
Okay. It will give us new statistical and registered data, and it was launched in 2023. And it's a solution to significant gaps in the social welfare knowledge base in Finland. The register utilizes the client information that is documented by social welfare professionals and stored in Kanta services. The data or the knowledge will gradually accumulate, and it will significantly grow with the mandatory deployment of Kanta services. The data flowing directly from the Kanta services will be a significant change because previously statistical data has been produced separately. Because of that change, we need new type of cooperation with the data providers to get quality data. For example, we organize workshops with the well-being services counties to examine the quality of that region's own data. And of course, we cannot compromise the data protection in any part of the process. The other significant change is that now the data is on individual level, and this will open some new opportunities. And here's some examples of the results. We now have better knowledge about the number of social welfare clients nationally and regionally. We also have first estimates how much the clients are using different social services. And we also have more detailed information about the background of social welfare clients. For example, about the labor status of the adult social welfare clients and about the previous services for those young people who are subject to child welfare notifications. All this information can be used for the management purposes and also for the development of the social services. And now we have briefly traveled through the path of information from the need for quality information to the information usage for the benefits for the client. There is some more information in English on our website.
Thank you, Erja. I think, we lost you again, but we had the thank you and the final vision. And as I said in the chat, we will share all these slides. I think it's really, really interesting what you just told about everything that we want to do with data needs foundations. And this is how do we put the foundations to speak the same language, to make data interoperability possible, and then to provide these services. And so that's why I really wanted to start with your presentation. And I hope you will be able to see us because I see you coming back and forth on the camera, but I think you can see us well. And I think everyone got the idea of the presentation. And as you said, the information is available on your website in English, and I found it very, very interesting. And I invite all of those of you participating who are interested in the method, how we structure data, how do we need to put in place the pathway to discuss with the different authorities and with the different data providers on how do we put that all together, and what for? What are the services we want to provide, who we want to address? So I'm sure we will have a bit of more discussion on that later on. Okay. Now I'm moving to Teresa, and yeah, we will have the discussion with both of you afterwards, if you agree. Teresa, from your side, from the Irish point of view and from the Department of Social Protection point of view, we wanted to hear a bit more about concrete examples. And so your screen is being shared, and we see the version with not the full screen. So if you can try and share it full screen, that would be great.
This is where the problem arises for me
now.
Exactly.
This is where.
Here I go again. Share. So I have the full screen. Have you got it?
And now we have, again, this 2 versions. So you should go on display settings and
display swap.
Exactly.
How are things?
And now it's good.
Okay, right. Okay. Good afternoon, everybody. And thank you very, very much for the opportunity to be here today with you. I want to very quickly go through. Sorry, apologies for a moment. I just it's just moving on for me.
It's all good for us.
Are you seeing slide changes or?
Yeah, now we are
a bit behind. Yeah, slide 1.
We are in your intro slide.
Okay, right. I'm going to do a very quick overview of the department, myself a wee bit, and then get into the down business of what we have done. Interesting enough, listening to the other presentation just now, we are actually further on. We do have, and I will mention it in a few moments, we do have a central repository. And that works very, very well. And I see the points that will be made previously, so that will work for those missions. So a little bit about us, right? I'm the Deputy Secretary in the department, and I want to thank you sincerely for having me here today and give me an opportunity to talk to a wider audience on how we deal with data and what we do with data and how we use data for the customer service. I'm the head of operations, basically, and as such, I suppose I'm totally focused on customer service, innovation, proactivity, how we can use data to actually be proactive and give a good service to our customers. So that's our major push in relation to this. We have a mission. It's for active participation in society by inclusion in society to income supports, employment supports, and other services. As a Department of Social Protection, we do that. And this is easily explained by just actually taking this a quick slide here. For us, we actually look after people from birth. We register at birth because we have authority over the General Register of Deaths, Births and Marriages for the country. In addition to that, during school meals, child benefit, unemployment, sickness benefit, maternity, paternities, employment supports, right through to pension supports at the end of life, and then on to the register of the death at the end. So we actually take you through the whole cycle of life in the Irish social welfare system. I'm not going to go through it in any great detail, so I'll just move on to my next slide. Now, with that in mind, insist I'm going through the whole lot because I had to head up there. We're a country of about 5.3 million people, and the social welfare, my bill, the social protection bill, is 24.9 billion in 2023. So that's what we spend on social protection, as 22% of government spending. So we're probably the biggest department. We have about 6,300 staff. Interestingly, as well, we're probably the biggest bank in Ireland because we do more physical transactions than any other bank in the country, payment transactions and schemes. So getting down to the main thrust of this, data sharing, enabler and protections. For us to data share with other organizations, and we share both internally and externally within the department. I was interested to hear that in the last conversation about sections of an organization not speaking to each other. We speak internally on a one shared database, and we share information across schemes proactively to look after customers. But we share externally as well. The Social Welfare Consolidated Act is our act that we, as amended. So that gives us authority, and we have a schedule of all organisations that the department shares data with. So we actually have legislation, prime legislation for the sharing of data. And of course, we're governed by the GDPR legislation. Real part of data sharing is data good governance. So we have to have very strict governance. We've had a lot of relationships with our data commissioner, our country's data commissioner, and that has actually made us very, very aware of our constraints and also our responsibilities under data sharing. So we work very, very closely with that. My department also owns MyGov. MyGov is the government-wide network where you can interact with all public services. So individuals can have a MyGov account and register on MyGov. Of the citizens of Ireland, which is about 5.3 million, over 4.8 million have actually got a MyGov account. And of those, they can authenticate yourself to Authentic Level 2, which actually is verified account. Once you get to a verified account, you can transact, you are knowing. Your registration and your verification on that MyGov account actually makes you known to all government departments. And you can transact business with all of those government departments, and you're accepted to be who you are because you've authenticated yourself to that level. So it provides for the sharing of data and the capacity to work across government departments. We maintain that system, but under that system, we have MyWelfare, which is our version of the same system. Now, what allows for the sharing of data primarily on the IRIS system is the way we store our data. We store certain parts of data in the organization generically. And what I mean by that is identity, all the customer identities for the country, everybody's identified in the country. We actually share an identity database. That identity database is kept pure and kept up to date. And the customer itself can actually update their own data on that database from external through MyWelfare or through MyGov. In addition, contributions, when people work and they put up contributions every year, which qualifies for certain benefits and across the state, they are held separately. Schemes interact with those and actually take the information to use in their scheme, but they're still held purely in one location, and other organisations and other internal schemes can actually interact with them. Means people have schemes that are actually use means data. In other words, what your actual means are and do you qualify for a scheme. Means data we keep as well in a separate as pure basis, and schemes interrogate it and take from it what they need for their scheme. But we also share that data across through APIs, both internally and externally to other bodies, so quite a wide range of bodies, to health, education, student grants, and many more sections of the Irish government. Back-end systems talk to each other. We have cyber protection, you say, and people are educated in sharing of data, in how we share data. API services, we use API services to actually deal internally with the department. So that's one of the things we use quite substantially, and we have probably in the first, up to September of this year, we have about 50 million API calls, both internal, which 30 million will be external and 20 million are internal in the organisation. So we're sharing data on a continuous basis. That data sharing is primarily with the bigger group that we would have is with the system for student grants, the system for medical cards, which is free medical care, that assessment has to be done. We would share means data and payment data with those. And also the local authorities that do housing, we share data with them from our own shared databases that we hold. So we share data extensively using MyGov, MyWelfare as the sources of sharing that data, and API sharing across government departments. Now, sorry?
Just one little remark. It's very interesting. We are perfect.
Go slow.
Time. Go a bit slowlier, exactly, because not all of our participants are native.
My apologies to you all. I even get in trouble in Ireland for talking fast, so I'm sorry about that. My apologies to all. I'm going to go, though, at a lower level, right? Just to one example, right? I have two examples in this particular pack, but I'm going to go one example of how we use data internally, the data we have internally and the data we get from other organisations, how we use that to actually provide proactive services to customer. And I'm going to go to the very first service that's provided is that of a child, a born child. So in Ireland, children are primarily born in a hospital, and the Department of Health, which is another government department, actually manage and organise that. At the point of birth, they're obliged by law to provide to my department, the General Register of Births, Deaths and Marriages, the details of the child's birth. So they provide that electronically within 5 days. That is their requirement. So once that data actually is provided to the Department of Social Protection, it comes into the General Register's office, and the General Register's office registers the child automatically. Now, the parent has done nothing, but the data that the hospital has collected has been passed on with the child's parent details. So they register the child's birth, and they give it, it now becomes a citizen of Ireland. It now has a registration and is actually a citizen of Ireland. But the General Register's Office don't do that. They then pass the data 3 places to the Client Identity Services, which actually gives the child its identity. And the identity in Ireland is given at birth, is given a PPS number, which is a public services number, which you will have for all of its life across all public services, and will use it across all public services. But Client Identity Service automatically then returns the PPS number to the Register of Births. So they have they have the PPS number attached to the birth of the child. But it sends it to other places. It sends the parents now a notification of their child's PPS number, which it will have for public services from here on. And it sends a message to our child benefit section. And our child benefit section is where we pay an allowance to parents for all children in the country. It's a universal payment. It's not means or contribution based. It's just paid to everybody. It's also, by the way, exportable across Europe if we're the competent authority. But child benefit then takes the data it's received, and it automatically sets up on its systems, because the systems are now talking to it. There's no human being has interaction. This is all systems talking to each other. It sets up a child benefit application, and it decides that claim, putting the mother's details in as well, because we pay it to mothers, and it creates the claim and creates the payment, right? With that in mind, there is a regulation that we have to have the mother has to claim child benefit. So we now communicate for the first time with the mother. And we say, look, we've got your details. Congratulations. We've got your details. We've got set up your child, Mary, Johnny, whatever his name is. And we're now going to pay your child benefit. Do you wish to claim it? And we also require from you payment details. And you can do this online or by paper to us. So they respond to us. That's the only piece that they have to do in the whole puzzle. Once we get that details, we actually then we then actually move on, and the process complete, payments kicks in from that. From there on, till the child is 16 years of age, they will continue to receive payments. There is control activity on it, but along with receiving payment, they will now have an identity. So what have we done? The state has provided the child with a record of identity and lineage. They've attached it to his family. They've given it a PPS number for all public service for the rest of his life. The child's benefit claim and payment has been created. And all this is based upon minimum data collection from the actual adult, the person that is involved. So we've proactively done that. Now, this is just one scheme. We do it over quite a number of our schemes. We use the data we have and the data from other organisations. The next example is actually quite similar. I'm jumping that over. It's in relation to a work and family payment, which is an employment support payment for somebody who is leaving one of our schemes or has never been on our scheme, but is going to work, but they're going to low income work. And the key here is that it's easier to try to keep people in low income work, and then they'll probably moved on to better quality work afterwards. So what we do in this instance is, we know, say something to one of our customers, they've left. Sorry, I keep using that and I shouldn't. So they've left. So they were on a DSP payment and now they've gone to work. So we know that they have children. This payment is only payable if you have children. So we know they have children because they would have been getting an allowance on their welfare payment for the children. So we take that person and then we match their data costs to our revenue, which revenue service where they collect tax and work records of individuals. So we have direct access to theirs through API, and we check, have they started working and what type of income are they on? And if they're on an income under a particular level for their family size, we then generate a work and family payment claim for the individual. and we set it up. And we put if the income is under the threshold, we set it up and we create the family payment. Then the customer is notified through their My Welfare account, because if they have been with us, they have a My Welfare account. So they have their own personalised account with us. So we write to them and say, look, do you wish to claim work and family payment? You have an entitlement to X amount on top of your earnings because of your income level. And they come back and verify that they want it. And we ask, do you want us to use the payment details we previously had for you, or do you want to provide new payment details? So in actual fact, the customer is paid, and they didn't have to make a claim. They didn't have, first of all, know the entitlement, or they may not know it existed. They didn't have to make a claim. We proactively managed them through to an additional payment. And the outcome of that is the entitlement that might not have known about, they have been given. It also means sure that they can actually stay and work. It's possible for them to stay and work on low income, and with the intention of moving on to better working time. And again, it's all based on minimum data interaction with the customer, using the data we have in a very effective, efficient way to make sure that customers get the best possible outcome from what we have. So moving on, I'm going to my last slide. And this one, I don't know what time I've left because for some reason my clock disappeared. But anyway, the data, oh yeah, I'm 1 minute. Well, okay, right. Data is powerful. We all know this. Data is a really, really good way to actually, and I'm only focusing on customer service. We use it as well for planning. We use all data for different things. But just on this particular webinar, I'm sticking with planning. It's powerful. It allows us to actually, as an organization, to use our own data across our own organization, all parts of our data, and keep it in a manner, store it in a manner that's usable by other organizations as well. So we share data within the organization, across organizations, and it drives customer service, giant up customer service. Customers don't have to come to us looking for everything they need. We actually go to them in quite a number of cases. Another example would be pensions. We proactively go with pensions when people reach a particular age. It creates efficiencies. Is proactive, and it also supports us in doing control. Data protection is a big thing for us. We legislate for it. And as I said, we have our own legislation that actually underpins all of the stuff we're doing. Now, if I were to say maturity-wise, where are we? If it was in a human being's life cycle, I'd say we're in our 30s. Coming up to our 40s. So there's a long way still to go in relation to what we can do, and we're on a journey. But we have the basis, and it's interesting the last speaker was speaking about putting the base in place. We have the actual basis in place for a number of years, which allows us to be very proactive with our data. And as regards data protection, we have a very strong data protection board. We do DPIAs with other organizations and with internally among ourselves when we actually share data. But it has to get cleared that it actually is up to the standard and we adhere to the things. So making best use of data available to government to enhance services to our customers is a priority for my department. And we're committed to doing it in an open and transparent way and making the journey for customers better. Thank you.
Thank you very much, Teresa. I think it's very concrete and it shows how data sharing and actually identifying the people at the beginning is one of the key elements too. If you can stop sharing your screen. So
I'm trying to. Back. I'm doing my best to get rid of it.
It's, I think, at the top. Yeah, exactly. Perfect. I don't know if Arya is able to go on camera and if you can hear us, but I hope all of that works. Yes, great. We have, and also Alfonso, thank you. We have now a bit of time for discussion, and we already have some questions in the chat and in the Q&A section about a lot of questions about data sharing, and we expected these questions. But before we go into that, I wanted to hear a bit about you on the pitfalls, the difficulties you faced when launching and working on these projects, and maybe some key tips how you overcome these difficulties, or what are the key success factors in that kind of project. I don't know, if Arya, if you want to start again and we go that way. And
yes, you can hear me now. Yeah.
Yes. Mm-hmm.
Okay. I think the main pitfall may be that if the change in information management is treated purely as an IT change, because I think the development must be based on social welfare's own needs, and its information needs. We, of course, have to consider technical frameworks and conditions, but they cannot lead the development because the change must serve social welfare and its clients.
So the question of what for, why are we doing all
Yes.
is a key element for you.
Yeah.
Teresa?
From my point of view, the whole area of data protection is very important. It's one of the things that you really and truly have to be super, super careful in relation to how you deal with it, and that you adhere to all the principles of data protection, because you can spend an awful lot of time being knotted up in that. And we were on one particular incident here in Ireland for quite some time. The other thing is, I suppose we started about 20 years ago, over 20 years ago at this stage, when we started building a new system, internal system for our own back-end system, which actually talks to each other. And out of that came opportunities that heretofore we never had. And I suppose bit by bit, building on that, we built that certain pieces of data would be kept pure, that would not be changed. So we learned that you need to keep, say, identity data. You need to keep means data. You need to keep contribution, that work data that people would use. Very, very clean and up to date on a continuous basis. That way you have a basis, and there's lots of others, payment data as well, we would keep in the same way. It forms the basis to allow sharing, and everybody can share it, take the data down and use their own rules on it, but you can change the base clean data and you keep it clean. So that took that was hard learning. And it was very hard to convince, say, officers when they were working on a case, you must put up all the means data. Well, I only need 2 pieces. No, you must put it all up, because somebody else will come after you that will want the other data as well. To get people to work in a way that they actually populated databases with stuff that they didn't see necessary for their particular scheme type. So it was that type of, and that took probably the biggest part of our work, convincing people. But then when they saw the benefits in return, and the automation we could do across other schemes, it actually became a lot easier. But I think data protection, proactivity, and making sure that people actually upload very clean data, and giving the customer a chance to do that themselves, then as time has gone on, has really made it a lot easier for us. They can actually do it themselves first online.
Okay, so you have a team or a service that is now responsible for keeping these key data clean.
We have different managers across the organization who are responsible for each of them. Say we have somebody who's responsible for payments at a principal level, somebody's responsible for client identity, somebody's responsible for means data. So we have actually allocated them to individuals who collectively own our whole database, but they're individually held and responsible. Responsibility goes with it as well. And I think you have to give responsibility with anything like that to make it work.
Yeah. And then, so they are responsible for the information to be correct for the rest of the system.
Not just for the rest of the department, for the rest of government, because all of this data is shared across government with proper controls in place. Yeah.
That's very interesting. And so you're starting, Teresa, speaking about data sharing. So I'm going through one of the so we had also some of these questions about, you mentioned already, both of you, the legislative basis that was behind it, and that gave you in both projects the opportunity and the possibility to act and to share data. There were some questions about how do you guard against data breaches? How do you tackle these data protection issue? Maybe we need a little bit more on information about how the security of the system is secured, even if I know that both of you are not security people, but I suppose you have some contacts. And
security-wise, here in Ireland, the Department of Social Protection owns its own systems, and we keep them on-prem. So, and we have technical people subject matter. Now we have supported by providers. A lot of providers work with us. We have a framework for providers that work with us, right? So first of all, we keep our information on-prem. We share it, but we keep it on the department's farm, write our own databases. Now we are thinking about moving to the cloud because that may be more secure. We have serious cyber functionality, and we would spend quite a substantial amount of money protecting our systems and our databases and our data. Like we have business continuity plans, we have security plans. We have a serious investment made in security and maintaining our data and making sure that it's not open for a cyber attack or for any attack. Data breaches, we monitor data breaches on a continuous basis, and we monitor databases right down to an individual putting a wrong piece of data into an envelope. We do all them as data breaches. We have a lower level of data breaches. And I hate saying it out loud because I always get nervous when I say it. We are very lucky we have had no serious data breach at all. We have probably in a year, we have about 100 of somebody put the wrong letter in the wrong envelope. And we go through a full process on every one of those cases. So we take the management security of our data extremely, both technically and individually. Every officer has to go through data protection training on a yearly basis. And they're reminded over and over again of their obligations. You're also reminded when you log on to our systems of your obligations under the management and care of data. So we take it because I suppose we had interaction with the data commissioner. It has made us better. So sometimes it's good, makes you better.
Thank you.
Yes, maybe I can add something from the Finland's point of view. Kela is responsible for the maintenance of the Kanta services, so they are responsible for the technical data protection. But in Finland, there's regulation about the access rights to client data, and the information systems should be built accordingly. And I would also like to mention that the log data should be monitored so that the professionals that are seeing clients' data really work with the specific clients. If you understand what I mean.
Yes, yeah. So that you can only have access to the data that is useful for you in your business, in your job.
Yes,
that's
what I mean.
And Arja, actually, there were some questions for you regarding, you mentioned a regional manager of documentation. What exactly is the role of this person? And there was another question regarding, do you collect data from different areas of social work from all different service providers in one central data source? Is it really like exhaustive and going into all kinds of sources?
Yes, our data model covers the whole social welfare data needs. So it has child protection and elderly people's services and all the other services that we need data from. Yes, it's a really big data model, but we want it to be a whole data model because there are some similarities in all services because they make decisions and they make plans and so on. But about the documentation coordinator that every region has, they help the social welfare professionals to document, and they can help the discussion in their own region that how should they document things to get quality data. So they are kind of building bridges there in their own region.
Yeah, very interesting. That's another question we had about change management and communications a bit. This is a role that they are endorsing, if I understand well, also to make sure that you mentioned earlier the necessity to explain why we are doing all that on data, and that it's not a technical question, but it's a business question, a question of service, a service question.
Yes, and it can also be difficult to find a common language because you need different skills and experts to in this information management and in the change process, and we need a lot of people who can build bridges. And that's why it's important that, for example, technical people get to know about the substance, in this case, social welfare, and also social welfare experts get to know get to understand the technical boundaries. I think it requires education, training, and certainly a lot of collaboration.
I don't know, Teresa, I have a question for you otherwise.
Okay.
But if you want to comment on this one.
No, in relation to
Communication.
actual protection, how individuals in the organization are controlled, everything they do is recorded. We record everything everybody does, so we can actually run a scan and find out who, if say for instance there was some question over our assistant actually came and asked us, has anybody accessed my data? We could tell you exactly who had accessed your data. We have that level of recording on our systems. In relation to each individual officer, we allow everybody read access to data. But if you're only doing certain transactions, you're role-based. Our systems work on role-based transactions. So you have the role to do X and Y. For instance, I used to be, when I was different grades, I used to make decisions. I now don't have the role to make decisions because I manage all decisions, but I don't make them anymore. So we take roles from people and we add roles to their profile to allow them to use data. So it's a very secure way, but they are reviewed on a regular basis. And as people leave the organizations, their profiles are wiped or archived rather than wiped, but they have no longer access, or you lose a particular role that's taken from you. So we're very thorough on that. Now it's hard. That is hard work with over 6,000 people to make sure that we keep all those roles effective. But I suppose talking, my colleague from Finland, in relation to having all the data, they're going about collecting a load of data together from different organizations, the different types of organizations, right? Whereas we tend to work on each organization of government. Revenue does employment and revenue, to collect revenue. Education does education. They all do it. But it's our ability to share data directly or get data directly from them without owning their data. So it's the putting in place of conversations through API with all organizations that you can call. Like we do a huge amount of work too for, say, the guards, which would be the police authority in relation to something. But there's rules about what they can get and when they can get it and who can get it from us. So we hold an awful lot of data more than anybody else because we have the identity data of every citizen. We have the employment data of every citizen. We have the means data of every citizen. We have and we have the birth and death register data of everybody as our base data that we own. So with that, and then our schemes, which payment data as well. So we use all that, but we share it, but only according to who needs it and what for. And we also take data of other people to allow us to do what we have to do.
Very, very interesting. Regarding one question for you, regarding also the capacity for the person to intervene in his data, and you mentioned that you asked the people also to manage potentially their data. And Pablo is asking us, potentially, would it be possible to people to use the data for themselves? For example, to use this data that is in your information and to share it with external service providers, or even to make that service available to others. Is that something you thought of?
Yes, but there is sorry. First of all, they have access to their own data. I mean, we're making their MyGov account, if they authenticate themselves on MyGov, right, and they have the authenticated to the level that it's, we actually accept they are who they are, and they have a log on and everything else to do it. And then through that, they come into My Welfare, which is their account with our own person. Revenue has My Revenue underneath MyGov, so we all have our own. So they come into My Welfare, they can see their own data in My Welfare, right, and they can make amendments to their address, to their locations, to different things they can do. They can make applications for our schemes in there, but they also see data in relation to their contributions, in relation to their means. All those are stored and visible to the individual, so they have access to their data. Now, the second part of your question was the one that I was actually going to get to, which was about
to use the data for external services and to share it with other service providers?
Well, we do share it with other services. That's without saying. They have the data. We share our data with other services. Like, as I said, we share it with education for grants. We share it with health for medical supports. We share it with the local authorities for housing supports. So we share it with all those organisations, but we share it in its pure form. We don't interpret it, we share it in its pure form. They can interpret it the way they wish to interpret it. But I think there was a nuance on that question, actually, that I just wanted to get to, and I've forgotten what was the last sentence of that question?
Well, the question is exactly, how do you see sharing this personal data in a secured environment with people so that they could use it for themselves, or that it could be shared with external service providers? Have you done it? Is it planned?
Yeah, so that's the bit. Shared with external service providers, they can take certain data. Let's say, for instance, your history of work. You can print a copy of that off the system for yourself. You can share with whoever you like. It's your data, right? But there is certain things that we don't share with private organizations because of the risk. We won't take a risk that data might be inappropriately shared, or that for some reason somebody might get access to somebody else's data. So there is a certain level. You may take a copy of it. Now, we are talking about having a wallet, a NI wallet, right, where you will have a lot of your data. And the government here in Ireland are trying to put together a wallet, a digital wallet, right, where all this type of data will be we would give it to the individual to put it into their wallet, and then they can share it. Take it to Europe for your EHIC card when you travel to France, and say your medical expenses are covered because this is in the wallet. And that's in its starting. Now, there's an EU wallet as well being generated, as you probably well know of. So the Irish one and the EU one have to be compatible. So we're kind of waiting for the final parameters of what the EU wallet specifications are before we proceed down something mightn't make the specifications we need. So we're actually in that conversation, but waiting for a bit more direction from Europe right now.
So we'll speak a bit later on at the conclusion about this European data space and the EU wallet. There's another question for you from Francois, and I think Michael goes a bit in the same line, noticing that as you are now in a semi-automatical way or almost automatical way informing people about their rights, there is a question about, have you seen a significant increase in the take-up of benefits of the system, and has there been a budgetary impact on the total on the budget?
Yes, there would be, right. We have seen both, right. There is a take-up. I mean, we brought a new scheme online and actually made it very, very easy and proactive just to hit a button and you get a service, right. So that service used to be, say, around 2,000 a month. It's now 4,000 a month. So, but it settles down. And I suppose one of the underlying principles of myself and the secretary of this department is we want people to get what they're entitled to. And a lot of people go through life without getting their full entitlements. It's our function and our responsibility to make sure they get their full entitlements. So yes, it does cost. I mean, we've taken in certain schemes from other areas of government, and we're a great organisation for growing them. And the numbers have got substantially raised. I mean, the numbers of disability schemes has rose substantially because they've been made easier to acquire. And we work with people to make sure they're getting their entitlements, right? We work with older people in pensions, so everybody is proactively asked about their pension when they come up to us pension age, or if we can award them, we tell them we've awarded them at pension age. So we do, but substantially there is an increase, but it's not as substantial as it causes a major issue. I think the increase would have taken place anyway. It's just we're making it easier for people to get where we're going. That's our line anyway in relation to this, because central government mightn't be as pleased with us.
For both of you, we have some questions again about this data sharing literacy, and how do we educate to data sharing, and how do we educate not only our computer or data scientists, but also social workers and people who work with the system. So we have a question from Cormac Forcantu, who's working in university and teaching programs as a university educator, and he's wondering whether we should not begin to teach data sharing literacy and that kind of systems to other than data scientists, and if you have any idea or suggestion on how to educate people on this data sharing literacy. And there was another question for you regarding, would you have a recommended ratio of data-focused staff versus non-data focused staff that is necessary to achieve that level of data literacy? So I don't know if you already have a ratio.
Well, just on that particular one, everybody in this organization has to be data literate.
Yeah.
Everybody, irrespective of what job you have access to quite a lot of citizens' data. And as such, as such, your obligations under that are very, very strictly controlled and monitored. Not that you have the access, but we take it so serious that you have to understand and be educated in the use of data and where the parameters are. I suppose the first part of the question, if I go to that quickly, it's about, to educate people into sharing data. Yes, but there is a big constraint on sharing data too. You have to make sure you've complied with all the steps. Is it appropriate? Is your data in a condition that it actually is up to date and thing? Are you sharing pure data, right data? Are you sharing with somebody that legitimately has a need and a want for it? What is their need for your data before they get it? Like, we go through a very rigorous process before we set up a relationship with another organization, but we will share. And it will happen, but it goes through a very strong process. So it's a kind of an education both across government and an education internally that people have to respect and have to take account. So we log people's identity that actually use data. And they're our staff, and we log their identity very strongly, what they touched, when they touched it, why they touched it. We have that information. So we share data very willingly, but we have very strong controls around the sharing data. And I suppose if you said, how do you educate people to become to open to data sharing? We would also be shouting at people, data is important. You don't access data you don't need. You don't share data inappropriately. We would also be having that message, because that side is equally important. If data is inappropriately used or shared, the consequence for citizens and consequence for vulnerable people or well-off people, no matter what, is huge. So we are very conscious of that while being as proactive as we possibly can, but within the parameters that they have identified themselves clearly, who we are talking to, we know. And the organization we talk to, we know. Does that make any sense?
Yeah, so this is what you mentioned about concretely regular training and the fact that they are trained on a very regular basis, and regular process monitoring to make sure that we use the data correctly, and potential controls on the fact that you can control who, you can monitor who is using what data.
And like with data protection legislation, we get a lot of requests from individuals, from citizens to say who has actually the access to my data and who has accessed my data. Now, it's easing off a bit, but when the new regulations on the GDPR, the right data access request, when that came in first, we got substantial. We were nearly snowed under with people looking to see who had accessed their data. It has settled down because they were very disappointed that nobody had accessed their data a lot of the time. So it kind of became itself burned out, but people get very obsessive about their data. Now, I would be I suppose working where I am, I would be very cautious in relation to sharing my data and who I was sharing it with. So it just comes, but it's to get that message. So yes, data is powerful. Data can be used so well and make citizens' life better, much better, and to get what their entitlements, and that's right across government, irrespective. I'm talking from a welfare perspective, but it's across every other state department as well. Mm-hmm. But it has to be done in a way that actually protects the data of the individual all the way through, and really focus on that as well. So I wouldn't be going a big education spread, share data. I'd be very cautious about that.
Jessica, I was wondering if I could ask a question to each of the speakers in relation to the two programs that they presented.
Yes, maybe we hear Arya just on the comment on data, and then exactly.
I think MyKanta is making the documentation more visible for the clients, so they can also, as Teresa told, that they can contact their own social worker if they see something is incorrect in the documentation. We are more in a data documenting phase, and it's really important that the usability of information systems are good, because it has an enormous role in the work of professionals. The usability affects the professionals' attitude to change in documentation and information management. So
the user-friendly aspect and the fact that the system is actually making it.
Okay, I lost you again.
Yeah.
Sorry. Yeah.
No
Too
worries.
much.
But we heard your message, I think, on the fact
Okay.
that the system has to be very user-friendly and user-adapted
Yeah.
to make it so that they understand where the data sits, and what it's for. Alfonso, you wanted to?
Yes, I wanted to ask a couple of specific questions in relation to the presentations. One for Erja. In Finland, you have had this transformation, transferring social services from the municipalities to the counties. And I mean, I wonder how the two things have been working together in a way. When we were looking at the European semester, one of your colleagues told us that they feel there should be a mandate for the counties to collect information related to social services. And I was wondering, when you talk about the data, how are all the different administrations at different levels collecting the data? And in particular, with this new system of counties, how are they abiding by this process of collecting data in a certain way and using a specific platform for it?
I think it was a bit of a surprise because both of the legislation have been in a process for a very long time, and it was surprisingly that they both were accepted really near each other, and so and also we have this economical situation after COVID-19. So we actually had to postpone the mandatory use of Kanta services. The original year was this year, September 2024, but we had to postpone it to September 2026. So it was a too big change because these two different changes together. Yes.
And do you feel that there has been cooperation, or is being a process of, I mean, how do you feel in relation to the way those in social services are, let's say, welcoming this change?
I don't know if I got your question, but I think now when we have 21, 22 well-being services counties, they have bigger shoulders, of course. I think it's easier than with 300 municipalities. So it's, but they have just started, so they have a lot of things to discuss and do in the well-being services counties. So they are in a progress. Yeah.
So mandatory reporting won't be obligatory until 2026, you said?
Yes. And of course, there's always some resistance to change, and when adopting any innovations, there are the early birds and then there are the late bloomers.
And if I may, I had a question also for Teresa, because when we look at social services across different countries, one of the key issues is how professionals from different administrations can request data to other administrations. You were highlighting how you are open to that, but just a very practical example. If you get someone, a case manager, a case worker, who is, let's say, assessing the situation of an adult with a disability, or an older person with long-term care needs, how can this person actually link up with yourselves for, let's say, certain type of data that they may need to assess the situation of that person? Because in some countries, it's a real challenge.
Okay, more than likely you are talking about a vulnerable adult or a safeguarding person, right? And we have obligation under safeguarding legislation, which the safeguarding legislation belongs to the Department of Children, Integration, Equality. It's a big, long department's name, right? So they have the primary responsibility for that. But in relation to the schemes that we operate, so one of these people who may be being assumed to be being abused or coerced would probably be one of our customers, a pension or somebody with a disability.
That's right.
So we would share data. Now, there's individually shared, we would share data individually with something like that because the legislation on protection, on safeguarding protection, actually covers all organisations of government in Ireland, right? So we would be obliged to give information to the Department of Children, Equality, that department, in relation to an individual. We'd have no difficulty doing it, but they wouldn't be the normal big sharing of data we do, because it would be more on an individual basis, and we would provide the data as required. There would be no blockages to that, because we all work together in relation to cases such as abuse or risk of abuse of individuals.
Or also, it also refers to assessment, for example, of someone in relation to, I don't know, residential care or home care, or, you know, those type of services as well.
Yeah, well, home care is dealt with by the Department of Health. We don't do home care, but if they're doing a means assessment of a household for home care, then we will supply the means data that we have already on the occupants of that house. But that will be through an ordinary, the larger exchange, through an API exchange, they'll call it, if we authorize them to. So that acts in a very scheduled way. It's not restrained. But one of the things when you were talking earlier on about all of this, about using electronic maybe, or online, or everything else, we have an actual obligation in Ireland to always provide services using paper all the time. So irrespective of, we're getting very, very proactive and very, very technically based, and building systems and schemes for everything. We still have an obligation, if I as assistant choose to deal with choose the Department of Social Protection paper-based system, we will support that. We will continue to support that. And I suppose, in fairness, seeing as we've been only working online probably since before COVID, in relation to online applications and online processing of claims, it's interesting that I'd say we probably have 70-80% of coverage online. People make their application, they want to interact with us, but there is still, and there will be for quite some time, it's a bit like money, paper money. We still have an obligation to hold paper money as well. So there's certain things that we hold, and people kind of have a right to get their business done that way. So, and we're maintaining that. We're sticking with that.
Thank you. I think we come to the concluding remarks, and we wanted maybe to hear from you. Well, before I think we can stay. We don't need the PowerPoint, just to stay together so that you see us. It's nicer. Thank you. Arja, what are the next steps for you? And maybe you wanted to react and speak to us a bit also about the European social data space as a final vision also of where we could head towards.
Yes, thank you. It's an interesting topic. You may have heard that the European Parliament approved the creation of European Health Data Space, and it's a health-specific ecosystem. And the goal is to, for example, empower individuals to control their own personal health data at national level and also EU-wide. And I have heard some weak signals about the social welfare data space, and I was wondering, do we need one? Of course, I don't have the correct answer, but I do think that we should discuss the subject. It doesn't have to mean that social welfare client data is traveling around Europe, but it could mean that we are able to provide trustworthy setup for the secondary use of client data, as Alfonso mentioned, social services index. But for that purpose, we would need at least some unified specifications, which we don't pretty much have nowadays. And I think it's great that we have ESN as a network, so we have the opportunity and the platform to discuss such vitally important subjects.
Exactly, Alfonso. I don't know if it resonates with potential ideas for future workshops or debates.
Well, when I hear what you say, I think it's almost futuristic, really, because I can tell you that I would say we are not ready for that at all. I mean, indeed, what we are trying to do with the social services index is to get a picture of what's the situation of social services within the countries, and it's extremely difficult to get.
Yes, I know.
We do have a good amount of knowledge in relation to benefits. That is good. Social security, some social protection as well. But when it comes to benefits in kind, it's actual services, is extremely complex. And some of the questions within the chat were along those lines, some of the issues that people face on a day-to-day, which is, do case managers or case workers from one particular administration can access the data, which sits in another administration? If you look at different government levels, is very different in a country which is centralized versus a country which is decentralized in terms of outsourcing. And of course, there is the questions that Teresa was mentioning earlier on around, I mean, how do you grant, let's say, access to a third-party organization from the private or from the non-profit sector to be able to access the data? You need to make sure that you've got the safeguards in place and what is right and what is not to share. So it is extremely complex, I must admit. We are trying to do this exercise, and this year we managed to get 13 countries to understand a little bit better what's the situation of social services. And indeed, what we realize is how complex and how difficult it is to collect the data, and how actually we do miss data in a number of areas as well. So those are some of our key recommendations to actually improve first some of the data collection in a number of areas, and then discuss internally within the countries what type of mechanisms should be put in place in terms of sharing and accessing data across different levels. I think that is, I would say, the key discussion before proceeding any further in this particular area of social services.
I know it's hard even in Nordic countries, and we are pretty similar. Yes, thank you.
Teresa, what are your next steps or your vision?
Next steps. I mean, I'd said to you earlier on, if we were to look at our maturity and take it in a person's life, we would say we were in our 30s going towards 40. And that's our maturity. So there's huge opportunity. We have a lot of years to live yet in relation to movement on data and the more proactive movement of data, both sharing internally within our organizations. Well, we're pretty good on that one, but externally sharing as well. And getting data from other organizations that mightn't be quite as forthcoming as we are, so that we can actually do more work. But just an interesting point on the sharing across Europe. There is actually a system called ESSI, which is European Social Security, something. Anyway, and it is actually up and running. So if somebody in France wants to check on have they any contributions in Ireland, or the French authority want to know, have you got X in Ireland and I want your record, it's actually done electronically. We provide it electronically across Europe. So, and that's up and running. In fairness, we had Ireland Inc. and the Department of Social Protection had a huge input into the actual development of that. So we're very proud of it. So like it's starting to move in all areas. It's starting to use in all areas, and in fairness, the Nordic countries were very proactive in relation to the easy development as well. So so it's interesting. But where are we going? We will continue to build on our data. We are working. Our next step is aiming to go to the cloud with our data. Now, there is a major thought process for us. I know most organizations just go to the cloud and they don't think about it, but for us, it's like taking your baby and putting it someplace you can't see it. So it really is. And that's the big debate for us now, is going to the cloud and action. The other debate is actually AI. We don't use AI. We have some exploratory projects on AI within the organization, but we keep them very controlled, and it's deciding how we will use AI appropriately in the future, and actually to add to this whole data matching, data movement, data linkages. It's all of that, using artificial intelligence for some of that. But as I say, we're doing a number of exploratories, but we're not doing anything in real life yet as an organization. And we will try, we won't be the first signer up, but we won't be the last either by any means. but we will actually see what it can do and how we can control it. And there is very strict rules in relation to it. It's even stronger than other data. AI used data or AI developed data is much more a higher bar to reach before you can use it. So that's where, and we continue on going the way we're going. But there's plenty of opportunities yet, lots and lots of opportunities.
Well, thank you very much. I think we are getting out of our time. We had many participants. Thank you again, Arja, Teresa, for your time and for these very interesting insights into your projects. Alfonso, I don't know if you want to close or announce future events or anything, or if we stop here.
I mean, we can stop here. Of course, we would like to highlight that data is a key part of what we do, as we mentioned earlier on, and particularly for us, the data in the area of social services, along with others in social protection and social security, and hence this is something that we would like to emphasize. And again, remind everyone that the call for contributions for next year European Social Services Conference is open, and we would love to receive proposals until the 19th of November. I'd like to thank you, Jessica, and colleagues in EY for putting this together with ourselves. And I'd like to thank obviously Arja and Teresa and everyone else for attending, because I think it's been a great webinar, and look forward to continuing discussing this topic in the future.
Thank you all.
Goodbye.
Thank you. Take care.